Hello and welcome to the program. I'm your host, Neal Howard. Thank you so much for tuning in today to Health Professional Radio. Our guest is a returning guest, Dr. Pepper Schwartz, professor of sociology at University of Washington. She's returning as a leading relationship expert to discuss with us this segment, the impact a healthy sex life can have, and also to dispel some of the common myths surrounding sex drive. Welcome back to Health Professional Radio, Dr. Pepper Schwartz.
Thank you very much. I'm glad to be here.
When we were here before, you gave our listeners a little bit of a background about yourself. For those listeners who may have missed that segment, could you give us a little bit of background in how you came to be an expert on relationships, especially where those relationships concern female sexual health?
Well, I was studying for my PhD at Yale University. I started out actually in studying law and society, but at that time, late 60s, early 70s, there were a lot of movements, civil rights movement, gay rights movement, and the women's rights movement, including a review of their sexual rights and a quest for more knowledge and more empowerment in choosing how to live on sexual life. And so I did a kind of a right turn, decided to study sexuality and relationships, and have been doing so ever since, conducting research and also trying to bring that research to the general public, both men and women, because I know how important a satisfying sexual life is to people's happiness and well-being, and even their general health.
When you're talking about their general health, what type of impact does a healthy sex life have? If your sex life is not as good as, say, your professional life, and you're making just gangs of success and kudos and money and everything else, and some of your other interpersonal relationships are going wonderful, are you saying that everything else is going to fall apart? Is that such a big part of it?
Well, a lot of people think sex isn't important, but the data tell us it is. There's no study, and there's a lot of studies, trust me on this one, that are on the relationships of sexual satisfaction to relationship satisfaction and life satisfaction. And there's strong correlations in both directions, that your sexual life is not like, a thing apart from everything else you are. If you don't think your sexual life is satisfying, if you don't feel sexually connected to yourself or your partner, that is correlated with less relationship satisfaction, less life satisfaction. So I think that's critically important. Now, can people, deal with something that's going wrong in their life, including their sex life? Yes, they deal with it. We did this large study from the American Sexual Health Association where almost 49% of the women were talking about problems with arousal and desire, and most said, how do you feel? Deal with it. What do you do about it? They don't want to deal with it. I just go on with life. So yes. You don't necessarily go in a corner and just sit there and keen, and nod and, just not able to function. But the fact is what we've seen in very different kinds of research come to the same conclusion. People, when they don't feel their sexual life is going well, they have lower self-esteem. Sometimes it actually starts to depress them enough so that they start working less well in other parts of their life. It can have very big impact on their relationship. They're not enjoying sex anymore. Their partner knows that, and their partner either takes it personally, like I'm being rejected, or they worry about their partner having an affair, or they think they're going to need to go elsewhere. They don't like having a sex life with someone who either doesn't want it so much that it's rare or gone, and or somebody who is obviously unenthusiastic about them. So, one of these things can cascade into the other. Yes, does it lower in importance as people age? Yes, it usually does to some extent, but it really depends on how important each person thinks it is. And, of course, when it starts to go sideways, as it often does in people's 20s and 30s, way before perimenopause or women going into menopause, it's particularly difficult on a relationship and on one's own sense of, am I wrong? Am I normal? And fortunately, a lot of this is kept to oneself and not shared, and therefore becomes, kind of a secret pain. And one of the things we learned in the women's movement is if you talk about things will get better. You can get community from others. You can see you're not alone. But unfortunately, this one, particularly after women get married and they don't want to talk, about the privacy of the relationship, it just doesn't get talked about enough. But the data is pretty clear. Your sex life affects the rest of your life.
How do you start the conversation with, say, your healthcare provider? You know, you're there for something totally unrelated, a cold or whatever, and you say, you know, well, since I'm here, let me tell you about this thing. You know, I mean, your doctor should have at least some insight into your personality and your life. But as you said, it's such a private thing. There are so many, I guess, myths and misconceptions surrounding it. I'm sure those spill over into the healthcare professional's mind as well as the patient.
Well, exactly. And so I think, you know, what I would say, I know some physicians and healthcare providers just have a checklist that they give their patient before they go in, you know, and it's everything from stomach pains to orgasm to sexual interest to earaches. I mean, you know, is any of this of concern? And let people just check it off. And, you know, and you can say, you know, I noticed then that you checked off your sex life of concern. Can we talk about that? Or what kind of questions do you have? I mean, give somebody an opening so they feel this is a reasonable thing to bring up. Most importantly, if they do bring something up, like, well, you know, my personal life's in a little bit of disarray, or I'm having some sexual issues, be very concerned and supportive and, you know, recommend things. I think a lot of docs, I know they're overwhelmed. I know health professionals have more and more bodies that they have to, you know, deal with in a given day. And I'm not asking everyone to be an expert, but they could do something. For example, if it was a desire arousal problem, they could send somebody to the health site that the American Sexual Health Association is partnered on, called findmyspark.com, which would give the person some resources and doctors and experts on that area. Or they can just do a little bit of work and find out who are the sexual medicine people in their area who might, you know, center on this in their practice, and have a couple names to send people to. The important thing is not to stop anything, to give everybody permission to treat it as serious. And, of course, I'm trying on this end to empower women, whatever their sexual issues are, to talk about that with each other. There is community on findmyspark.com. You can talk to other women who are having this issue and see what they're doing about it. But just in general, that women become, you know, advocates for their own sexual health. That is part of their larger health, indeed. I mean, there's all kinds of research on actually mortality and morbidity differences between people who have sex life frequently and satisfactorily and those who do not. And I understand there's a chicken and the egg thing. It may be that healthy people are much more likely to have sex, et cetera. But I think there's some independent effects here that should make health providers perk up and say, I need to know what's going on with my clients. I need to help them in this area, and maybe I need to inform myself more.
How do you educate and bring awareness to the healthcare professional who's set in their ways when it comes to female sexual health, who doesn't want to attempt to differentiate between someone simply not being in the mood or someone who has an actual physiological or maybe even a psychological or social issue going on where sex is involved? You say there's tons of research out there. There's tons of research out there for everything. But when you're in the industry and you've grown set in your ways, how do you dislodge some of that stubbornness?
Well, you know, I'm very sympathetic with health professionals. I really am. I don't think it's stubbornness so much as there's only so much I can do. You know, I'm a general family practitioner. I'm ear, nose, and throat, whatever. I can't know it all, and I get that. I understand. But all I would say is get referrals in the areas that you don't feel comfortable with. Have something to give your patients other than avoidance or embarrassment, because you may be the only person they talk to, and if they get shut down, then there's can be a world of suffering that goes on. And I know that healthcare professionals don't want that. They want to at least be able to give somebody something that's a lead. They could even recommend going to the ASHA site, the American Sexual Health Association site. They can just find a list of printed materials to go to. I'm recommending findmyspark.com, but there's other places, other resources. All they have to do is even have some information in their offices if the person, or if the person comes in. But they can also educate themselves a little bit about how sexual life is in fact involved with a larger personal life. It's interesting. I mean, a lot of physicians and health providers have found when they're looking at men that if these men are having erectile problems, that these could be associated with heart issues, with circulation issues. That could be in some ways a canary in the coal mine. Well, if women are having other kinds of issues as well, that might show other larger physiological issues, and they certainly need to take into account that if somebody has had a very atypical experience where they've had persistent loss of sexual desire, persistent lack of arousal when they're both A, young, and B, used to have it, this to me is a health issue, and it's something that, I'm hoping providers will say, I hadn't really thought of it that way, and maybe I'll just start to be a little more compassionate and investigative and responsive in this area. I'm not asking them to become specialists, but just care and find out what they need to find out.
It's been a pleasure talking with you today, Doctor.
Thank you very much for having me. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with returning guest Dr. Pepper Schwartz, professor of sociology at the University of Washington. And we've been talking about the impact that a healthy sex life can have outside of the bedroom and dispel some of the common myths associated with sex drive. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm.